welcome to this episode of Broken Roads. I'm Colin Mackell, and today, obviously, I'm joined by yourself, Jason Shiers. So, hi, and tell me a little bit about who is Jason Shiers.
I have a love-hate relationship with titles. People tend to listen more if you've got some form of credentials, but actually I just like to be a human being in these conversations. Do have a long experience of working in the psychological field as a psychotherapist, as a coach, in multiple modalities of psychotherapy, in spiritual teachings, in different forms of change and transformation, and had a long personal journey as well along with that started when I was very young, which is really my guiding light behind all my work, which is the reason for the reason I've got any credentials is just purely for personal reasons, is because I went on a personal healing journey and I thought that the credentials would somehow qualify me to help myself, so that's really what everything's, a little bit about. It's not the depth of the story for sure, but it's a little bit about who I am and what I do today.
Okay. So I've kind of resisted the urge to look a little bit further into you and your work. I wanted to do that on purpose because I wanted to meet you for who you are and what you kind of obviously want to bring to today's podcast. And again, I'm happy at any point throughout for you to kind of ask anything you want about me, and we'll get to the end. We'll get to that anyway at the end if you want to. But you often say that addiction isn't a problem; it's a solution. Can you explain what you mean by that?
Like to share, like I like to use my personal journey as a kind of metaphorically and as ways, teaching points and stuff, I was into the system, so to speak, that what we might call the traditional psychiatric, psychological, and perhaps more traditional methods of recovery, 12 steps and therapeutic ways, into that system at a very early age. And all that anyone ever did was see what was wrong with me. What's wrong with him? How can we fix him? What's going on with this kid? Why is he so outrageous? Why is he so uncontrollable? Why is he so out of control? How come he can't stop taking drugs? Why is he committing crime, going to jail? Lock him up in the psychiatric ward, send him to prison, do all this stuff, and no one ever asked why the addiction, it's just like, it was just the pathology over the top, there's something wrong and we need to fix it. You need to stop, you need to stop what you're doing. But there's a reason that people can't stop. There's a reason that people continue, and that's because drugs and chaotic behavior, process behaviors, process addictions, of whatever type you want to look at, are not the problem. They are the solution to inner turmoil. And the system, like our system as a human being, the biological organism of the human being is wired for survival and safety. Like that's its biological standard, Now, it doesn't make any sense to the knowledgeable, intellectual mind to say that addiction is a form of intelligence, because from a knowledge point of view, it doesn't sound very intelligent to self-destruct. But from a biological organism point of view that's wired for safety, then if there's inner turmoil, then it finds a way to find ease and comfort, through processes or behaviors or substances. So that's really why, to give a bit more context around why I say addiction is the solution, not the problem, because it is finding us ease and comfort from our inner turmoil, which is a response to our early life adversity, our early life adversity, our connection or our lack of connection, whatever happened to us in our upbringing and early life experiences.
I guess what I was hearing, again, please obviously feel free to correct me or help me understand it better if I'm getting this wrong. You described the response to, for example, pain or life, or it as kind of being involved in processed addictions or substances or whatever that might be, however it might be labeled, is actually an intelligent response, a way to, let's say, protect the system, a way to protect, against or inure against the kind of the what's going on. And in terms of if it is an intelligent system, or if it isn't an intelligent response, in what way is it intelligent? If we look at it against the backdrop of addiction, where people will kind of follow that response, perhaps to their own demise, perhaps until they die. And which way is it different from? So how can I understand that? Because instantly, as you say that, I do see, and I do agree that addiction, from my understanding, can often be, or not addiction, depends however you want to kind of term it, but the response to kind of reach out and find comfort, to kind of, try and find a way of managing or mitigating some of the experiences that we might have, especially painful ones. And I definitely draw my own story there. That there was a lot of pain going on as a child that I couldn't articulate, couldn't understand, and I couldn't, I talk about it today as if I had a fully fledged kind of intellect. I didn't. I only experienced what I experienced, and I didn't understand or interpret things in the way that I do today. And I definitely think that perhaps much worse things would have happened to me as a child, as a young man, as a person growing up, if I hadn't found ways to mediate the intensity of some of those experiences. And that way is kind of a way, I suppose, I see it as an intelligent response. I'm just wondering, is there an evolution from that point of understanding about it being an intelligent response, by which it then becomes perhaps what about when addiction goes to the extremes and we die because of our addiction?
Yeah. Everybody goes there, it's like everybody takes the metaphor to the extreme, and wants to really understand it that way. And yeah, that is what happens, because it's like I said, the difference between knowledge, like, as I said earlier, it doesn't seem like a very intelligent thing from where we're sitting right now, right? I mean, it doesn't seem very good idea to smoke crack cocaine to the point of self-destruction, for example. Or to inject heroin with a risk of overdose. Doesn't seem intelligent at all to the mind, to the knowledgeable mind, to the intellect, to the learned education, that we've got about what's good and what's not, what's healthy and what's not, right? That is all learned information. You're not born with that. That's not on board with you as you're born. It's something you've learned. And there's loads of variations of what people call health and what people don't. And like, the system doesn't know, it's not educated in that way. It just knows inner turmoil and respite from inner turmoil. That, like, yeah, okay, we start off, like, let's say, I don't know, the first time I used heroin was the first drug I ever took when I was 13 years old. And I said, oh my God, that's it. I'm free. It's kind of like, I've been waiting for this my whole life. How come I never knew about this sooner? Why would I not do this again? That was my reaction to taking heroin, because I'd been in inner turmoil since my father was killed when I was 5 years old. And since then, I'd been in psychiatric wards. I'd been medicated for depression. I'd been locked up. I'd been in all sorts of chaos, expelled from schools, homeless, at a very young age. And so finding that experience, and the very first experience was like, oh, God, yeah, of course. It's kind of like, there you go. Because what happens, right, when you take an opiate-based drug, is like your inner system numbs. It goes numb. Your emotional experience, your physical and somatic experience. You're not full of tension like this at the world all the time. You're just like, oh, yes. It's kind of, so you're, for quite a lot of us, because of the autonomic nervous system, we're walking around in tension, but we've learned to we can't shake in society. We can't walk around all day shaking and looking like big-eyed, tense people. So we've learned to suppress. As part of the system, we've learned to suppress. We've learned to look normal, act normal. But like, there's the straw that breaks the camel's back for people that are holding tension and suppressing somatic experience. So the drugs really just numb us from that, and when we find it, it's like, oh, yes, a respite from myself, a respite from my internal somatic experience, from the mental noise, the overthinking, the obsessive thinking, and all that stuff that comes with it. And that will continue to destruction, yes. You know, of course, to me and you right now, that doesn't look very intelligent. I fully agree with that. But that's not what I'm looking at, you know, because hopefully for most of us, you know, and I've been to a lot of funerals too, and I know this isn't always the case, but for most of us, at some point, addiction opens the door to looking within, you know, to the point where the drugs stop working, or you end up in prison, or you've trashed everything in your life, you become homeless, destitute, and so on, like I did, and a lot of other people that I know have. And you know that we through divine intervention or whatever reason, we end up either in the rooms of 12 steps, or we end up finding freedom through some of the methods, psychiatric means, or some of the different type of recovery. And then, you know, the door is open to look inwardly, like, what is going on? What is all this? What is all this an escape from? What is underneath all this stuff? Because we take away the drugs, we stop the drugs, we stop the numbing, we stop the solution, we're still left with a problem. So then we have to learn how to live with ourselves, you know, learn how to live with our own internal world, our obsessive thinking. And quite often that is why, pushing this further, you know, quite often that is why when people go to 12-step rooms, they put down drugs and alcohol, they pick up sex, they pick up relationships, they pick up gambling, they pick up food. I don't know about you, but when you go to 12 steps, people go in at 7, 8, 9 stone guys, and within 3 months, they're 15, 16, 17 stone. You know, it's kind of like, that's not by accident. You know, it's because, like, food is a comfort. It's a place to find ease and comfort. Many of them have multiple relationships, obsessive relationships. In my work as a therapist, you know, when I was perhaps 20 years clean, 15, 20 years clean, I still had secret addictions. And I was a therapist, and I had clients who were therapists for drug treatment centers and so on, who also had secret addictions, didn't tell anybody about, you know, confided in me. That's what goes on, you know, like the fire hasn't been put out.
Yeah, there's a lot there, Jason. I think a lot of let's say affinity with some of your experiences. I mean, one of the things for me is I was first raped when I was 4 years old. So my mum abandoned me when I was 8. I never met my father. I certainly experienced difference in pain and existential threat from a very young age. And again, I'm expressing this very, let's say, sophisticatedly today. I was just a kind of a mess. So yeah, of course, my nervous system would have been shot to pieces. My sense of safety, there was no comforting. There was definitely nothing there that kind of helped me feel ease and comfort and kind of brought me back to a sense of feeling safe. And yeah, my first drug wasn't heroin; it was solvents and cannabis, alcohol, and cigarettes. Shortly, around 14-year-old was the first time I experienced heroin use, and I was sick. And the very first time I tried a small amount, but my real encounter with heroin, which somebody injected into me, I overdosed and was kind of out for about 12 hours, or it could have been longer or shorter, but I was kind of taken out of the house because nobody wanted to deal with somebody who had overdosed, as is often the way. You know, nobody wants to get arrested or have to answer questions. I was a young kid. They dragged me across the road, left me. I remember waking up and hearing people, buses and people's feet, and feeling kind of really kind of odd. And I don't think I'd gone, oh, that was great. I just remember having the injection and somebody injected me. I remember the rush, the blood, just the complete numbness, and then everything just went blank. I just remember this feeling like my heart was going to bust out of my chest. And then nothing until the time when I started waking up into my awareness. Now, the odd thing is that I immediately went back to the place that they'd carried me out of, and knocked on the door and asked for more. And that was the kind of the strange part. So there was something there. But I think later I definitely did experience my using as something that it took away my uncomfortableness, that feeling that I was strange, that I was a strange person amongst people that I didn't feel connected to, that I felt odd. I didn't feel odd. I felt part of. It kind of temporarily kind of filled up all of those places within me. And of course, as long as I would use drugs or any other substances or any other process addictions, then I didn't have to address those things on a deeper level. I didn't have to ask any deeper questions. I just had to take a substance. And I agree with you. It's my observation about people in recovery, including myself, who have been through many different experiences, many different twists and turns, that it isn't a one and done. There are many conversations that are going on in the 12-step and other recovery places, I suppose. And there is this, for me, this part of me, my experience of myself, which didn't find a place where I could be at peace and where I could find safety and where I could find an end to things. And I don't think that it's fully healed. I'm not saying here, I'm sitting here and I'm saying I'm a fully healed and fully integrated and fully whole person. I'm just more integrated and more whole than I was. It's been a long and very painful, very complicated, and very confusing journey, for sure. So I think it's I definitely identify with a lot, I suppose, of what you're saying. So, kind of moving on a little bit, you said that you've worked in psychotherapy, 12-step recovery coaching, and now you lead a radically different approach. What was the turning point that made you question everything that you'd been taught?
Yeah, it's a good question because it helps me put more context again to it. I understand that my approach is challenging to the, I don't want to say average mind because there's no average minds, but it's certainly challenging to people in 12-step recovery who've been conditioned, like conditioned through the 12-step process and conditioned through therapeutic and psychiatric processes. So yeah, like thinking of my own personal journey at 20 plus years clean in 12 steps, like a real 12-step person, conventions all over the world, sharing, being part of things, putting on conventions, doing service, regular meetings, multiple sponsors, doing the steps endless times, having sponsees, not somebody who went once a month or something. All my friends were in NA. I was a constant attendee of 12 steps, but I still had always felt this longing, this kind of like, I remember in early recovery, I thought, oh my God, when I get to 90 days, when I get to 6 months, when I get to 1 year, maybe that's it. And these milestones kept coming and going, but I never felt the peace that I thought I would get at these milestones. And that's why I became a psychotherapist. It's like, oh, if I become a psychotherapist, then maybe I'll find this, really not understanding what is this longing in my heart for. Like, what is this longing that I have? What is it I'm actually searching for in all these things? What is it I think I'll get at 6 months or 5 years or 10 years clean? I've made it. That's really what I want. I want to feel that I've made it. I want to feel that I'm there. I'm over the line, that now I'm safe. Now I'm okay. But I didn't recognize that longing as my heart's longing for itself, of me longing for me longing to connect to myself, because there was still let's call it a metaphoric gap, between my connection to myself, because for me, the 12 steps is layering a new belief system over the top of the pathology. It does work. There's nothing wrong with it. I'm not a critic of the 12 steps. I do talk about my life in meetings, and when people who are still using come, I tell them there's no other way that I know that's so helpful where you can go and get help and camaraderie and connection and friends and stay clean. So, but it, for me, as I see it today, it's a temporary part on the journey. It's not the whole way, because there's a limited understanding of what it really is, within the rooms. And so that longing that I had in myself at 20 plus years clean, I started to explore other spiritual things. I mean, this was after years of multiple qualifications in different psychotherapies. I'd done the Hoffman process. I'd done all of Tony Robbins' stuff. I'd done the Landmark Forum. Had a few different, I was qualified in CBT, in NLP, psychodynamic transaction analysis psychotherapist. And I still didn't find peace. All that same longing that I had for 6 months, for 9 months, for 1 year clean was still within me. It was still there driving me. I still had secret addictions. I still had behavior that I thought was off key. I still kept going through the steps and it was not touching the sides of it. I still had resentments. Every time I put certain people on my resentment list after 20 years, they were still on there. Like it was just I did not feel free of it. So I found myself, but maybe by chance and maybe by divine intervention, that I found myself in this spiritual, what was called an intensive, but it was not very intense. It was very relaxed, And I have what I call an epiphany or an awakening or a realization of sorts that, my mind is not me. It's almost like there's two. It's like there's the perception of subject and object. Like I'm thinking about myself all day long, but I'm noticing my thinking. Now, this is quite abstract and it's quite challenging for anyone to comprehend until you see it. And it's like an optical illusion. Once you see it, you can't unsee it. So I had this I was sat in this experience and I thought, like, I'm thinking about myself all day long as a flawed, damaged. I mean, I had 15 different psychiatric diagnoses. I've been sectioned multiple times, been in jail loads of times. I got my first medication when I was 10 years old for depression. I had an endless list of pathology and services that I'd been in that had not been able to help me. So I was thinking, I'm thinking about myself. I'm thinking about like my childhood trauma that I'd learned in psychotherapy, the concept of childhood trauma, about all these pathologies, all these diagnoses, these years saying I'm an addict. I'm going to a meeting saying I'm Jason, I'm an addict, I'm Jason, I'm an addict. I'm thinking, but I'm okay. I'm like, okay, right now, this minute, right now. I've always actually been okay this minute. And I've spent a lot of my life thinking that I'm not. So there was just this like gap, probably like big enough just to see a tiny bit of light through for me to think, what is going on here? Like, who's the thinker and who's the noticer? And it was like, and I just like, it was like things started to crumble in my life. Like the idea of pathology, it was kind of like, I thought, oh, there's nothing wrong with me. There's never been anything wrong with me. Like I've got 100% track record of being okay. Yeah, I've spent probably 90% of my life feeling not okay and wondering and waiting for being okay. This idea that I talked about earlier that okayness is somewhere in the future. It's at 6 months, 1 year, 10 years, 5 years. It's at this qualification. It's at that qualification. It's at this weight loss. It's at this relationship. It's at this sort of looking girlfriend. It's at this size of house. It's at this fast car. I'd spent my whole life living in that future thinking about finding okayness later. And I realized in that moment that I was okay now. And it was like, honestly, it was just like for the first time in my life without drugs, without anything, without some form of medication or being knocked out in a hospital, I was like, okay, right there and then, And it was very beautiful. It's so profound. And I'm sure it was a level of awakening going to 12 steps and stopping using, for sure. My life changed, but this was like on a new level because nothing mattered, in those moments. It lasted for 2 days at least, where I was sat watching the birds and listening to the birds sing and watching. And I was just like I was trying to find problems in my life, but I couldn't. I was thinking, well, my bank account's still got the same number in it. I haven't lost weight. I'm still a bit overweight, it's kind of like, and I haven't got a new girlfriend. I still don't like the one I've got, but I've got kids, and it's like, and it's a mess, but I'm okay. I'm good, So in fact, my life is amazing right this second, if I'm here now in my life. But once I go off somewhere else, I start to find these places where it's not okay. And I can take myself to a place of misery. And I realized that I'd been doing that my whole life, right here and now. I'd been okay. But I've been living in my head as my thoughts. And I guess I'd realized that there's a gap. There's a gap between this perceived gap of subject and object. There's thoughts happening. They're not me. They're nothing to do with me. I have to buy into them. And that was the start, that was perhaps 10 years ago, but that was the start of this, me creating what I do now that's radically different, and how I work with people. So first of all, it's an awakening process, it's a realization of like who you are beyond your creation of yourself, beyond the pathology that you've been told, beyond what you've made up along the way. And from there, it's a journey towards yourself. because that was the first start of the journey towards myself. Like, who am I? Like, what is really going on here? Instead of hearing and listening to all the things that other people had told me. Like, why did I believe I was an addict? Why, when I went to that treatment center in the early 90s and someone said to me, you can never drink or use again for the rest of your life, one day at a time, but you've got this disease, but you'll be okay as long as you do these things. Why did I believe that?
Why did you?
Yeah, why did I? Because innocently we have social conditioning and we perceive these people as educated, right? And it's kind of, we go into a treatment where they are therapists, doctors, psychiatrists, whatever they are. And because of our social conditioning, we think they know something we don't. So our own intuition is tuned right out of us there and then. I'm told this is what's wrong with you and this is what you need to do to be okay. And I just go, okay, for blindly for however long, I buy into the story that it's true and I identify myself in those words in the literature and I go, yep, they were right.
And who do you see yourself as today? Who is Jason? So if you obviously you say there's a gap in between the kind of the subjective and the objective, and you found yourself there, you found that freedom, and so unshackled from those parts, those places, perhaps when you were impressionable, perhaps you didn't have that sense of occupying yourself, you didn't take occupation of yourself, and therefore these people, because they occupied whether they wanted it or not, a more powerful position in relation to the information we fantasized that they had. We kind of projected that onto them. They have all this power, all this knowledge, they have secrets, and therefore, in a sense, without even perhaps realizing it. And I guess some of this is definitely true for me. I surrendered myself to them. They became quasi gods. They became kind of quasi all knowledgeable. And therefore, because I was afraid as a person, because infinitely inside of myself, I was more able to identify and relocate back to a place of fear where I shrunk up and I shriveled away. And therefore, they were this place to which I could anchor myself. I could kind of throw out a lifeline, hang on their ideas of me, hang on the labels of who they said I was. And also, I believe for a short while, the stories that they told and the stories that everybody else told, the stories that were already prepared, to which I attached myself. So what was it that you were able to, you spoke about that moment of awakening and then that disentangling and that realization, that moment of freedom. So who are you today, Jason? Who would you, and I'm not saying, I don't mean to put it on you.
No, it's okay.
Yeah.
It's good. I like that you have an idea of your own. I like that it's challenging, and it digs deeper into the subject. For anybody listening, it's valuable conversation. One of the realizations in that moment was that Jason is also a figment of my imagination. Like that Jason is also an idea that I've made up every single day, that I've attached stories to, that I have thoughts and feelings about, as if it's a real person. But upon investigation, which I have done many, like spiritual investigation, when someone says, who is Jason, and you start going, well, I'm not 53 years of old. I'm not actually Jason, because I wasn't Jason when I was born. It's like I was given the name Jason. It's like I was given all sorts of identifying things. I've got job titles, parental status, sibling status, relationship status, home status, personality status that I could go to, but it's none of those. So if we keep going in that investigation, nothing of which is essential to me being here. By essential, I mean, it's like if I wasn't here, I wouldn't be here. It's like none of which is essential. Then what is left? Jason is a manifestation of in the form, of the formless. It's like an idea, a figment of my imagination that feels and senses, through the perception of senses, and it is a bundle of thoughts, feelings, sensations, and perceptions. It is really, if we go as far as we can with it, looking at this way, there is no outside world. Like there is only the internal experience of the perception of an objective world. It doesn't actually exist. Sure, it does. It's too far to say it doesn't exist, but in the absolute, it doesn't exist. But we do experience it. We experience it through perception. So in that full, as far as you can go towards the absolute, that's the truth. But then I am a relative human being in the world of form, having an experience of being Jason, and we could talk about this stuff forever. It's kind of, I don't want to be right here, and I don't want to say my way is the only way, and I don't want to say this is true for everyone, even though I think that is true for everyone. But don't take my word for it. You have to look for yourself and find it for yourself and experience it for yourself to say it's true.
So is it kind of there's this interpreted world, this interpreted self that experiences itself as both kind of real and abstract at the same time. There's kind of this interplay, this kind of dance that goes on, and that in the world is experienced as a kind of a human being among other human beings in a relative sense.
Yeah. It's both and, the absolute and the relative. It's not like it's only the mind that thinks in binary and linear terms, right? When I differentiate between, in my book, I wrote about the brain versus the mind, right? And the brain being the binary computer that's really good for checking you got the right change, paying your bills, getting paid the right amount of money, and so on and so on. But that's not the mind. The mind is a spiritual, formless part, and that is if you want, our connection to the mainframe, to the motherboard. We get what's the right word? We're all part of that formless wisdom, that formless energy. No person is more spiritual than anybody else. We are all spiritual, having a spiritual experience, whether we know it or not. So yeah, you can kind of, so both and, like, it's the mind that's binary and linear, the brain. When I say the brain, I get confused. I talk about different spiritual concepts, so I sometimes use the mind and the brain interchangeably. But like, to clear it up, the brain meaning the physical brain, the mind meaning a formless connection to the universe, and the brain in that form is binary and linear. It's the sum accumulation of all knowledge that we've acquired over time. The mind having no limits to its capacity for connection or knowing the oneness of life.
Yeah, I was trying to kind of draw that into kind of my own understanding. I went on my own journey after 18.5 years in the 12 steps, started drinking. It wasn't all that was wrong with me at the time, but I went off on my own journey because I wanted to challenge, myself. Not so much I was challenging the 12 steps. I think the 12 steps is one of the greater things that has been created, and I still recommend highly people who feel it beneficial attend. But I also have very many caveats that I kind of throw in there as well for people, so that they can protect themselves and not be so kind of, let's say, soak up perhaps some of the faulty messaging that goes on there. And again, I'm a practicing Roman Catholic. My faith is in God. I believe we are a composite of soul, spirit, and body, and that we're eternal. So we're made for eternity. But again, that's me, and that's my experience. Now, I had a profound reconversion back to my faith. I had never really been a properly practicing Catholic. If I'm honest, I was born, baptized, given that, again, not through choice. But I re-chose my religion, and I found that to be one of the best choices in my life. So I understand a lot of the things that you're talking about. Again, transactional analysis, been there, done that. I've been through the multitude of different trainings, different accrediting bodies, different degrees, different postgraduate qualifications, different research topics, different spiritualities, different philosophies. And again, kind of looking, searching, finding, in fact, coming up feeling even more empty, hoping that when I had my moment, my spiritual crisis, which went on for years, and it was quite a place of desolation, I veered towards existentialism, looking towards nihilism and the philosophies there, and Heidegger and Sartre. And I was disappointed. I was looking for this rich tapestry, of which it exists. It's there, and some of the existential writers, I think, are some of the best writers that have existed. But there are Catholic existential writers and other people who have written on these topics that have just been forgotten about and wiped out by history in the greater sense, but still kept alive by the Catholic tradition. Kind of philosophy has kind of been pondered upon across many centuries, and St. Thomas Aquinas, for example. So I'm resonating with a lot of what you're saying. And also earlier on, I was kind of like really feeling for myself and for you, this kind of deep sense of sadness that we're kind of thrown into our experiences so young, so profoundly affected by things, and so unanchored. And yeah, of course, the world responds by psychiatric medication, psychiatric labels, and like you're right, telling us that there's something wrong, something family defective with Jason, with Colin. And I agree with you, and my perspective, I guess, my, let's say, less objective perspective is that because we are born as children of God, we're born with an infinite dignity that cannot be removed or replaced. Our natural image is that of God. Now, I equally don't drink. I follow a lifestyle. My life is one of complete and total abstinence. But again, that was part of my conversion, part of me praying to Christ, praying to God, and I did have the desire for alcohol removed. I didn't drink anymore, and I haven't been drinking now for way over 4 years. I don't think about it. It was a profound and strange experience, and my prayer was answered. And again, I know that this is unique. This is not something I've heard some people share these types of experiences. I had never experienced that before. Everything I had was a battle. Everything I had was an inner battle, was an outer battle. But like I say, for me, I'm still trying to live life in my human and because I'm human, and that's difficult. And having my marriage, being a husband, being a grandfather, I've got 9 grandchildren, got 9 children.
Wow.
And that's a challenge, right? But it's also a blessing. And understanding my faith has helped me understand suffering. It's helped me understand the necessity of suffering, even although the necessity of knowing how to suffer, not the necessity of suffering. Sorry, that was a kind of a poor choice of phrase, really. And I think, like, listening to people like yourself, Jason, again, and like I said at the beginning, I purposefully stayed away from trying to find out too much because I wanted you to bring all of your kind of wisdom here and tell us about this so that we can understand that. But it's definitely, I'm a human being. I resonate that I've had trauma or whatever we might want to call it. I had a dislocation in my experience that was profound and enduring. And so from that perspective, I was up and down in front of psychiatrists and psychologists as a child. And people telling me that I was wrong. I went to prison. I didn't get on with the 12 steps at first. I relapsed endlessly. I couldn't stay clean. All of those things. And so I was the typical, on paper, addict. I met, the prerequisites. I met the post-requisites. I was on paper. And it only took, it took a lot of very kind of complicated twists and turns in my life for me to begin to find some peace. And I've done that through my religion. But you talk about the infinite recovery model being different from traditional addiction treatment. Could you tell me a little bit about that?
Yeah. Yeah, that's not the full journey. The awakening is really the start. It's not the end. And because I often talk about, like, how could somebody asleep want to wake up? Like, how could somebody who doesn't know what it's like to be alive wish for life? you know, because they really don't know it exists, you know. And so when people are struggling, they come to me, they just say, I just want to stop. And I say, is that all you want? And they go, yeah, of course, you know, that's all I want. And I'm like, oh, that's just the start. You know, there's so much more beauty to life. There's so much more to wish for. But I understand, how could they possibly know that? You know, and if you told them about this amazing and beautiful life, about connection, about feeling joy and contentment and so on, and for no good reason, right? They couldn't comprehend what that meant, what you meant by that. So, you know, the realization of who we are, like on a deeper existential or spiritual level, whichever way you want to, you know, call it, you know, the breakdown of the belief in pathology and the me as a separate self, if you want, you know, from a non-dual spiritual term, like the me as a separate self that's flawed and damaged, the breakdown of that belief and that idea then opens you up, you know, to so much. Because, like, I see my work at kind of at the pinnacle of like trauma work and spirituality, like spiritual traditions, because if you're too much in the spiritual world, you try and bypass your experience. You try and become the person, which doesn't exist, as the spiritual person. So the ego takes credit for the spiritual terms and so on, and starts using spiritual language and to escape humanity. But if you're too much in the trauma world, you become entrenched in the story as this person who's got trauma, which isn't true either. There is a system that's faced adversity that has contractions, constrictions, and reactions to stimulus, i.e. life. There is a system, you know, but when you start calling it me, my trauma, my flaw, and so on, that's when you become locked into the story. So my work is at this pinnacle of the two, you know, the realization that we are not who we think we are. Well, there's much more going on than that in the spiritual sense of the world. When you see that, and then you go inwardly towards your system, your autonomic nervous system, your somatic contraction and reaction to life, to stimulus, because it still happens just by awakening to your spiritual truth. The absolute does not like give you respite from being a human being. You know, that's where many people stop and get stuck at the spiritual seeking for the, you know, I want to live life as the absolute, as oneness. It's like, no, you're a human being until the day you die, you know, and you're going to experience adversity. So when you have that realization, you know, you can then go, well, I'm having a reaction to this situation. So no, you can have reactions and you can look at it without the story of self. You know, like when this happened, my body tightened up, I tensed, I wanted to feel anger came out of me, you know, it's kind of like, and so we go inwardly in the somatic sense, you know, in infinite recovery is like, so there's the spiritual part of it, and then there's the somatic part of it, you know, like, and we go inwardly and we learn to live life in our body, to reconnect. I think where men and women are different, in my experience of work, is that particularly if you've had a lot of, like your early life and my early life, we've learned just not to feel. We just live life in our head. We've become very good at becoming intellectual, staying in our head, working stuff out, getting stuff done and so on, because we had to. But then for me, my experience of coming back into my body was intense. You know, it was kind of like I was feeling a lot, and it's like, you know, there's a lot of tears, a lot of contraction, a lot of sensation, a lot of like, God, I know why I got rid of this shit. You know, it's kind of like, it's intense. But also what's happening is we're having an increased sensitivity. Our sensitivity is increasing to ourself. So more joy as well as more pain, you know, always equal, parallel, you know, it's kind of like that. So in order to have more joy, we have to have more pain. And then the experience is like that, you know, we're just living life, you know, we're just enjoying our life. And sometimes it's up, sometimes it's down. Sometimes I'm angry, sometimes I'm sad, sometimes I'm joyful, you know, and I'm not pathologizing it. Oh my God, there's something wrong with me. I need to fix myself. Oh my God, what's this anger about? You know, it may make sense to do it, to have a cathartic release, to do a somatic investigation. And that work is really body-based more than mind-based. So I'm kind of like going into the body like first versus the mind. And I'm really become aware myself working with people, you know, when we drop out of the head where most people operate who've had some form of adversity, and we go, well, how do you know you're angry? And they'll go, well, I've got angry thoughts. And I say, well, where do you feel that in your body? And they'll go, I don't know. I don't feel it. And it's kind of like, I go, okay. And so let's get comfortable and let's kind of start to drop into the body, you know. And they might say, oh, my hands have got a lot of energy, or my legs feel restless. I can't sit still, you know. And I go, is that okay to be restless for a moment, you know? And all sorts of emotion will come out, you know. It's like, so we're going towards ourselves, you know, we're going inwardly, and without the story, oh my God, this is a fault, what's wrong with me? It's not about the past, because it's happening in the present. It's not about bringing up the past, but sometimes somebody will picture themselves as a young child. Sometimes somebody will have a thought about something that happened to them. It comes, but it's not about the past, it's about the present. This is being experienced right here, right now, in this moment, together, in relational. As we're wounded in relationship, we heal in relationship, you know. So I'm holding a space for the present to bring up what's there. And the thing is about this stuff, it's playing out in your life all the time anyway. If we don't slow down and create a space to look towards it, then, and that's the deeper somatic part of the work, you know, like after the realization that I'm not this flawed, damaged individual, you know, I'm not telling this story of myself constantly, perpetuating my own suffering and then escaping from it in drugs and processes. Then I've got to learn to be with this body that I'm in, you know, as a human being that's been conditioned.
So is the way in which then you would define the person, a person who is in constant, you know, kind of confronted with that kind of difficulty, especially those who might be experiencing that trauma, where the thinking has to become feeling, and the body is a place it's difficult to occupy because those feelings are alien. Those feelings at the beginning are so intense, so strange, so the natural response is to want to escape. The natural response is to want to kind of go back to thinking, or go back to the process of trying to find a way to kind of numb those, escape those. And so the idea is, if people can occupy their body and occupy those feelings and occupy that intensity, that actually they can learn to understand that this is who they are, and that rather than fear who they are, they can integrate who they are as a whole person. And so the person who becomes more fully experienced is something that there isn't anything that's broken or anything that needs to be escaped. There is actually just something where there is a coming into the self and understanding the self as a radically different way. And that in there, even although there's a lot of uncomfortableness and intensity, there's also this experience of freedom and joy, and that this is more authentic. It isn't a abstract analytical kind of yearning, perhaps in the way that the 12 steps can become quite prescriptive. You do this, you want this step, you do these things, you do this, is like you say, here now. It's very little to do with metaphor, very little to do with historical kind of experiences, very little to do with story and narrative and self-perception. It is about just being.
You made me think about, I like to call it a model of well-being. I don't have a great term for it, because it's like it's an experience more than it is a method, you know, or a you know, something in the form. It's an experienced journey. And you know, I would say most treatments are a model of illness, and I'd say what I'm offering is a model of well-being. And when you point people to what's right about them instead of what's wrong with them, they will, you know, like with complete certainty, with the knowing, because you have been on the journey yourself. You can't learn this in a book, and you can't just teach it from me telling you about it. You have to go on the journey to yourself. You have to go into the dark, I call it the dark room. You have to go into the dark room without knowing where you're going to come out for yourself, to be able to point other people there. When you point people to their well-being with absolute certainty that they have a place of well-being in them, then they start to see it for themselves. They start to look for themselves, instead of like, I mean, how different is that to traditional models where they're pointing at, Yeah, that's going to take years. That's really bad. You've got this and you've got that and you've got the other and so on. It's like you're almost perpetuating, adding a new layer of suffering to them. You know, it's kind of like, and for me, I'm pointing people towards what's right with them and helping them see what's right with them. And they do start to see it for themselves, you know, not as a striving place to get to, but as a fact of who they are, you know, like not as me telling them and them going, yeah, I'm going to think positively, but actually, yeah, I'm seeing this to be true for myself, you know, like the difference between knowing, like knowing in your heart, absolutely knowing beyond the intellectual thinking part of us, you know, it's kind of like, I actually know this to be true. I don't know how I know, but I just know that, you know, like for people to have that absolute certainty in themselves, and then they're kind of grounded in themselves more, you know, it's kind of like when they do get a bit off, when they have a reaction or something happens, let's say that somebody relapses, right? Because it's a common, I wrote a lot about relapse, about the idea of failure and the 12 steps, and the reason people press the fuck it button, what I call the fuck it button, you know, after they relapse, they go and self-destruct because they've had the belief installed, you know, that relapse is powerlessness, and powerlessness means you can't stop. And once you start, you may as well just continue. You know, that's installed. That's not a natural reaction. And in my work, when you're grounded in your well-being and you know, it's kind of like that you have it. Sometimes shit happens, life happens. It touches a deeper place in us that we haven't yet got to in our somatic work. Then you just come back. It's like, oh shit, that happened, you know, because the knowing is deeper than the thinking, you know, the knowing about yourself, the knowing of the grounding runs beyond adversity, beyond this moment of flipping out, of getting angry, of having a reaction to somebody, you know. So they don't go and press the fuck it button, you know. They don't go and go, oh my God, I'm just going to self-destruct. It's like they just come back, you know. The nervous system cells, all the stress response hormones, as they do, disappear out of your body, you know, and you come back to homeostasis, you know. It's like it happens, and then they go, you know.
So relapse or whatever can happen is something that catches a person unaware. It just kind of comes into their experience. They've had it. The 12 steps. To be fair to the 12 steps, I suppose, and it's not you not being fair, me. So I don't present the 12 steps unfairly. The 12 steps say lots of good things about coming back to being held, coming back, not being ashamed, not being all of the things that perhaps people instead in the 12 steps, and again, separation of people who attend 12-step meetings and the 12 steps themselves. But again, the people, the group can be more powerful than the personal, than the single person there. And also there's lots of people who are experiencing the kind of the somatic self in the 12 steps but not understanding, and so they have this adverse reaction to people who might not be seemingly conforming to the group think of the time, which is around abstinence. And so it can be a really alienating experience, and if a person pulls away from that, it can be so destructive for them as well. So I really like that idea of you bringing that into just something which is reintegrating, bringing that back in, doing the somatic work and coming back into the body and trying to learn intuitively that was just a normal response. Whatever went on was something that was a kind of a legitimate and intelligent response, as you said earlier to something. And what is, I suppose, for me, if I was in that position, working with somebody, I'd be just kind of interesting to kind of hold them and see them through that experience, and to kind of work more in terms of what is the learning about there, what was that went on, what was the experience, what was the feelings that were going on. And I think more than anything else, the 12 steps is about a place where people can go. It's free, right? It's always available. You can get a support system there. And I think the rich tapestry of what's written in the 12 steps is a lot of wisdom in there. But again, if you're an analyzer or a thinker or a task-oriented person, so if people like me and you have learned to do things in order to avoid bad experiences, or we've had to that's the way we've survived. It's not really any good for us, because we can't really get into the somatic stuff. We really can't get into that kind of deeper work that we need to do so that we can understand ourselves and move beyond those experiences, or find ways, not moving beyond, rather integrating, being with those experiences, being in the dark room, not being overwhelmed, feeling the overwhelm, and understanding that we can move through this as well. Now, you talked about the role trauma plays in addiction. How do you define trauma beyond its obvious events?
Yeah. I like the explanation in the book, The Body Keeps the Score, you know, like as in little t trauma and big T trauma, you know. And I saw a post today on LinkedIn. It was kind of like you citing the DSM, you know, and complex PTSD and stuff. And it's like, it's really the worst place to look to understand trauma, you know. Like trauma can just be the lack of presence, you know. It could be any form of adversity that had to be endured in childhood. Now, not necessarily measuring kind of respectively, like it's impossible to measure, you know. It's kind of like I had a parent who never saw me, you know. Every time I wanted some attention, they were busy, they were this, they were that. Or it could, you know, like that could be this, you know, one of the simpler forms. And you could go to the far end of abuse, violence, rape, you know. It's kind of like drug use, death, like happened to me, you know. It's kind of like and any range of adversity, something that the nervous system of the child had felt overwhelmed with and could not and did not have a, you know, a safe other to process, you know. And I like to keep it that broad, because that's what's happening, you know. It's kind of like we're being conditioned, you know. It's like by in relationship, you know, to our caregivers, whether it's mum and dad, or whether it's another caregiver or somebody that was influential in our life, doesn't make any difference, you know. And the response of our nervous system, that often, like if it's a pre-verbal experience, you know, and if you've done your own work, you've probably come across certain impasses and experiences where you've just had sensations and no words, you know, nothing comes. Maybe pictures come for early life adversity, and maybe just feelings of tension, outbursts, terror even, you know, can come in revisiting somatically those early life traumatic experiences. You don't know about them. You know, you don't know about in utero trauma. You know, it's kind of like core generational stuff that's passed down. It's in the amniotic fluid. It's in the earlier life that's passed down generationally and so on. You know, it's like you just know that when a certain thing happens, you feel tension. You know, not necessarily to this extreme that I'm doing, but to something happens in your body. I notice my chest feels tense when I'm leaving the house, or my mum was always stressed when she went out, or when I was pregnant, or whatever it is. You know, we could talk about this for ages, and there's loads of kind of like parallels that we could draw and loads of things that we could come to, but they're not exact sciences. You really, I like the idea that you have to make sense of it for yourself. You know, I can kind of point you there and give you ideas and so on, but we have to investigate, you know, like investigate somatically and see what shows up and comes up. And that's really how I see it, you know, like that. And I mean, I looked at, you know, a lot of somatic biology. I see what happens in the brain, how the prefrontal cortex goes offline, norepinephrine and cortisol release and so on, you know, that's happening in early life experience. I've studied all this stuff just out of my own curiosity, you know, to kind of see what happens for people. But I find going too technical with it really takes people away from the somatic experience of the moment. So just presence is really a healing energy, you know.
Okay. Now, you talked about the damage of labeling people with addiction or mental illness. What do you think happens when people internalize those labels?
I think self-fulfilling prophecy happens. You know, it's like when they internalize the label, they actually create, as I said earlier in the absolute, there's no real outside world, you know, and you'll know this for sure. Most people will know this, that quite often when people come, it's them. They did this, they did that. You know, it's like this happened, that happened, and so on. It's always about somebody else. It's never about me, you know. So there's no understanding of the perception of an objective world and another person. because really I see that the sole purpose of life is return to oneness, that life is guiding us home to ourself. And we are, we're born in oneness with what looks like to me could only be a seamless flow of sensations and perceptions as a child, because there's nothing learned at that point. Even the name, even boy or girl, isn't known. Nothing can be known. It can just be a seamless flow of sensations and perceptions. Everything else is an installation after that point via relational experience or via educational experience, or sensory experience. We create the people and the experiences to how can I word it? Basically, he's going to point us back inside, like the painful experiences, for example, are not by accident that we have in life. They're really life's lessons asking us to see something, to return to wholeness. And I guess if you look at that whole experience, from oneness, being born, just having a seamless flow of sensations and perceptions, to facing adversity, to creating a separate self, namely Jason, me, that has to do better, be more, is unlovable, and so on, with all these kind of core wounds. It's like that we then create this idea of ourselves in order to overcome this adversity as a separate self in this world, apparent world. It's like, but that doesn't work, right? It just fails, because we can't find fulfillment, we can't find happiness, we can't find contentment in an objective world. We can only find it inside ourselves. So while going on that journey from there onwards, in various ways, me and you may be into crime and drugs, other people in jobs and money and relationship, for example, maybe they never went that extreme. The end result is pain and struggle and suffering, and finding that things don't work, never work out, and don't give you what you want. Now, some of us, when we've had an extreme, that's why I say addiction is a doorway to yourself, and actually it's a gift in a shitty wrapper. Not that I would wish it on anybody, but it is an extreme adversity that forces you to look inwardly, and brings you home on that journey to yourself, if you're willing to accept the lesson. So that's, I got lost a bit there, and I can't even remember your question, but I don't know did I answer it?
No. Yeah, I think you did. I think I guess whether we answered it for all people, but you certainly gave me an insight into why the labeling people as addicts or mentally ill, and what happens to someone when they internalize those labels. And I suppose it's because they are labels. They aren't the full, they're by no means the full answer. They are patches and pieces of fragments and figments of an answer. And if they're taken as absolute, it just causes full of confusion. It just causes a sense of deeper alienation. It doesn't bring a person towards a sense of connection. And I suppose there's two ways of, I suppose, if somebody like me was was given labels as a child, as the insecure, frightened, confused child that I was, and young adult that I was, and it's definitely more dangerous because I'm more absorbent. I'm more able to absorb those things because I'm so lost. When I'm looking at myself then, not today, but I'm looking at myself, I'm much more resilient, and therefore, I don't run around looking and being lost and looking for things to attach to myself, in order to try and make some kind of meaning or make some kind of meaningful interpretation of who I am. But yeah, definitely, I can see, because the alternative, we hear the kind of, I suppose, the rebuttal of this is that some people feel freed by their labels. They're given an answer. It illuminates. So, oh yes, finally I understand I'm an addict, and therefore it set me free. We see these stories in the NA text where people have gone, oh, I was this kind of person, I was lost, I was doing these things, and then suddenly I found the 12 steps, and therefore the light bulb went on, and I then became free. But they're just stories. They're just stories that are inside a book, which is kind of like, used and perhaps overused. too much provenance and too much credibility sometimes, I think, is poured into those things, and they do little of addressing some of the more complex experiences of, I suppose, lots of people who will come there looking for healing, looking for something that will help them. People, like you say, when clients come to you, you say to them, well, this is the beginning of such a rich journey. Why settle for just being clean? Why settle for just, I just want to stop using, for example, whatever it might be? There's so much more on offer. And I think when people come through the doors, they just want to stop whatever, they just want all the stuff that was happening to stop. They're just looking for respite. And suddenly they're confronted with all these rituals that go on, holding hands, praying to God, the 12 steps, a higher power, a sponsor. All of these things are kind of impacting, compacting. And I suppose where people don't have a solid sense of themselves, and many won't, many don't, and I would argue maybe none do, then labels are very dangerous because they come as answers wrapped in kind of rhetoric from other people, and we are then trying to interpret them as we understand ourselves and our world and our experiences, and often they'll do little but confuse and lead us astray. And like you say, from what I'm understanding, and again, correct me if I've gotten this wrong, there's this sense of all of that can be left behind. We're not interested in that. None of that really matters that much. This is all about here and now. This is about going deeper. This is about going into the feelings, going into the self, going into that dark room, and that you will go with them and that they can go there, and then eventually they can learn to trust themselves and to not be so carried away by that. In there, they will find that healing. In there, they will find that unbroken part of themselves. They will find that part of themselves that's always been okay.
Yeah, the innate health is a part in my book, I call it the undiscovered territory. It's kind of like that there is a part, it's when I talked about earlier about knowing the well-being, there is a part of us that's never damaged, can't be faulty, can't be flawed, can't fail, doesn't disappear. When I talk about depression, I call it the pilot light. I look for the pilot light in people. Like, where is that pilot? Like the pilot light on those old boilers where you'd look inside and see if it's on before you turn the gas up. Like, where's that in people? Because it's always there if you look. If you know to look for it and you know where to look, then you'll find it. And so helping people discover that part of themselves and feel that part of themselves to a point where they know it exists. And it's not that difficult to really help people see that if you've seen it for yourself. Now, if you believe in pathology, then you've got absolutely no chance of pointing anybody to that, because that basically means you haven't seen it for yourself in yourself. So you can't point anyone else there. And going back to your point about labels, I was pleased, with my addict label at the time. And when I think back about it, I think it's really because I wanted the people around me to love me. And it's like, and I had an excuse then, I had an excuse. Look, there's something wrong with me. This is what it is all along. It's not been my fault. I've just had this incurable, fatal disease, and I'm going to be okay now as long as I do these things, so just love me, please love me. And it's like a relief, an eternal relief. Oh God, yeah, that's what's wrong with me. But after a while, what starts up as a relief, becomes a limitation. While I'm like you, it's kind of like sometimes I spill out, because I feel a little disdain towards like my journey, through spiritual traditions as well as 12 steps and other stuff. How come no one ever told me sooner? It's kind of like I spent 22 years saying I'm an addict and it's not even true. Like a little bit of that, but perhaps I just had to go on that journey, like to find what I found now. But like, again, I got sidetracked there, but like that initial relief, it eventually became a limitation, and I guess because I had this eternal longing inside myself and I was curious about that I followed it. I did resign to some extent, I can resign that this was my life and I'm going to go 12 steps and I'm going to be a psychotherapist and I'm going to have secret addictions and blah, blah, blah. And it's like, and it's going to be all right. I find a way to cope with it. It kind of become a bit like that, but there was still part of me that had that pilot light that I talked about, alive and searching and seeking and finding new things. And when someone said, hey, have you heard about this new therapy? I'll be like, yeah, I'll volunteer for that, like, because anything new, because I really still wanted, I wasn't satisfied, I wasn't satisfied with, and those moments that I talked about earlier, where I heard the birds singing and I had that kind of subject object perception, I felt home. You know what I felt in those moments was, I remember thinking that that's it. This is the thing I've been searching for my whole life. This is the feeling of home in myself, and I remember that experience thinking, wow, there's no more search. I remember that. And I never ever had come to that point in my life before, like, yeah, the label was some sort of respite and some sort of relief from myself, but that feeling of home and that awakening experience was something else, and still to this day, I still have moments like that, quite often. That was 10 years ago, and it's never left me. People, to quantify that moment, by the way, I'd still had eating disorders, like, since 5 years old when my father was killed. Up until that moment, at 22 years clean, I'd still balanced up and down with my weight. I went from 14 stone to 25 stone in treatment. I had 7 cosmetic surgeries in the first 16 years of my recovery, 2 of them in third world countries, because it was cheaper, because I was desperate to change my body. I still had a psychiatrist. I still struggle with relationships. And when that moment happened, all that stopped. It was over. It ended. It's like the eating disorder to this day I've been free of. Like, I ended a painful relationship I'd been in for years, and I met someone else that was the first person that ever loved me, and I let them love me, and that was the most difficult thing I'd ever done, was to let somebody love me, but I felt lovable myself for once. I felt like I could let somebody love me, and even though it was terrifying and scary and I was so insecure, it's like I went through it, I worked through it, and that relationship, that was part of my healing journey further towards myself. So much transformed in that. It was not just an abstract idea of the mind that happened. Like, my life literally changed to be unrecognizable,
Yeah, that's beautiful. I really liked how you said that, and I seen how powerful that was for you. It was exactly the same as I experienced that point in my life when I'd come to a chain of kind of unfulfilling, empty, loveless relationships. A lot of good people I met, as well as a lot of dysfunctional people, just like myself. But I hadn't reached the point where I believed I was lovable. And you talked about that moment when you kind of realized that you were lovable. You always had been lovable, and that instantly the kind of just everything shifted. And I experienced that profound love as well with my wife, who I've been with, and who I don't want to be. It's the only relationship that I don't think I want to be with someone else, or even though it's tough. Marriage is tough. Marriage isn't this kind of rosebed of kind of endless kind of peace, and it has its challenges, but it's so profoundly different and so profoundly full of love and so profoundly just different from everything that I'd experienced. And so I really see that moment when you spoke about there, finding someone who you allowed them to love you because you realized that you were lovable. Of course you are. Well, I also understand how profound and real that sense of carrying this around with us, that we're just not lovable. We're just not good enough, and how we project that onto other people so much as well, or how we did project that onto other people. And that moment of realization, yeah, I am worthy of another person's love. I really am. And this other person is worthy of love, of being loved by me. My love is worth something. That was a profound shift and a profound change as well for me, Jason. So I just wanted to kind of, kind of share that back really with you. So I thought that was a really beautiful, profound moment there. Yeah, powerful, very powerful indeed. Is that what you mean when you talk about unpacking the idea that you've got an innate well-being. So I think you've kind of covered that in a few places here, even in the middle of suffering. So the suffering doesn't take it away. You know, that kind of infinite place within yourself is not devalued or undermined or prejudiced in any way, shape, or form just because you suffer.
Yeah, for sure. It's always been there, and that was like on my journey, kind of through spiritual world, so to speak. When I first had that experience that I talked about, I had these two mentors, and you know, I feel quite touched thinking about it because, um, you know, because I'd had so many diagnoses over my life. Starting at 10 years old, I'd had an eating disorder for my whole life. I'd never been able to get rid of it. I'd done so much to my body, trying to fix myself and change, and was so desperate. And I had these two mentors, and I used to try and tell them stories about how damaged I was. Look, if you really knew how bad I was, and I call it terminal uniqueness today. That's what I call it. If you really knew how bad I was, if you really knew the stuff I'd done, if you really knew the crime, the psychiatric, like the fights I'd had in psychiatric hospitals, been pinned down and injected with shit, and the stuff that I'd done, if you knew, then you would understand why what it is you're saying doesn't apply to me. You know, like, and they were just like, bullshit, you know, they didn't buy it. You know, they said this applies to everybody, and they knew. They just knew it was in me, you know, and it was like, and after a while of this experience of hanging out, so to speak, you know, it's called hanging out. We used to call them transformative conversations. They were just really like conversations about where we talked about this stuff. I started to see it for myself. You know, I started to see it, what they were pointing to. I started to see what they were saying, and it was like, and I was like, and that belief in my own brokenness and that seeing of my own well-being, you know, like pivoted, you know, it changed from like me secretly believing that I was flawed and damaged to really seeing that, no, I had this well-being thing. It was in me, you know, there was no way they could be wrong. It was like, and it wasn't just because of their certainty. It's because of the way that they would point me to see it in myself. Like, really, you know, like we would look at stuff that I did and stuff, and they would like, but how come, you know, it's if you're so messed up, how come you saw this? How come this happened? How come you did that? You know, and so on. And I would be like, yeah, actually, I don't know, because the mind doesn't think like that when we believe we're flawed. It doesn't look towards the right things that we're doing, the good reactions that we have, the way we're present with somebody in a difficult situation, the way we don't buy into our own anger. Doesn't look at all that, just looks at everything that's wrong, you know, when we believe we're flawed. So instead, it's like there's a shift in the mind to look towards everything that's right and what's good, and then to see this well-being, you know, and it becomes like this beautiful grounded place within ourselves that we can lean on and know, like right now, like today, my life is not perfect. I'm very human, right? And it's kind of, I have reactions and shit. My kids annoy me at times. It's kind of like me and my girlfriend, we fight, but we come back together. It's like, it's so human, you know, and it's like, it means absolutely nothing about me. You know, it's like that sense of well-being within me does not leave me amidst an argument with my partner. You know, it does not go away. I don't think, oh my God, this is terminal. This means something, because we often just burst into laughter, you know, after shouting at each other and God, we got lost again, didn't we? You know, it's kind of like, what happened for you? You know, and there's beautiful presence and there's tears that come and there's a feeling of connection again. I'm like, oh yeah, we returned, you know, so that sense of well-being has stood with me ever since, you know, and I trust myself implicitly to the point where I created the Infinite Recovery Project, knowing that I have something there to share with people that's absolutely beautiful and essential to having a great life, without a doubt, you know, without even knowing how the world would receive it or anything. It was just like something that came through me that had to be done. Yeah, that's been a real beautiful kind of realization of that place in myself, you know.
Yes, it sounds beautiful, and the way you describe it is as well. And again, you know, the realness, the genuineness that you bring with that as well. And I think about that kind of experience for me sounds a lot like the way when I first realized the way that God sees me, the way that God looks upon me, rather than the way he thought, because I thought God hated me. I thought there was no place for me in a relationship with God. I didn't understand how beautiful God's love was, how infinite, how different, how so far away from any conception I could have even tried to understand. And just that understanding, that profound moment when I realized how loved I was, beyond beyond my understanding. Yeah, and that stayed with me as well. Yeah, yeah, really powerful stuff. You talk about working with therapists and professionals who are still secretly struggling. Why is it that that's so common, and how does it impact their ability to help others?
I think they become like their impact is questionable, you know, like their real impact is questionable. Like in the grand scheme of things, like even going back to when you were talking before, I was having insights when you were saying about the pathologizing labels and the damage to people. It's like in the grand scheme of things, you could say that that's actually part of that, what I was saying about life's purpose, about returning us to ourselves, you know, because another label, another label, another label becomes more and more difficult. It's trying to point you to something. It's trying to point you inwardly, you know. Even though I speak out against pathology, I see that in the grand scheme of things, I see that you know, the value, not value, is that the right word? You know, maybe, you know, it's kind of like the purpose of it. Utility, yeah. So coming back to this, you know, it's kind of some beautiful people just haven't seen what I'm pointing to, you know, and it's because you remember when I talked about the journey from the seamless flow of sensations and perceptions to adversity to creating a self that is involuntary, entered into the rat race, you know, which we call humanity, right? Of better, of more, of bigger houses, faster cars, more status, more credentials, expert, you know, it's kind of like PhD, expert addiction. It's the identity, right? It's kind of like, so the deeper they are invested in their identity, the less chance they have of seeing what we're pointing to, because it means letting go of that which I have created myself to be in order to be found, because really I am lost, right? So looking at that, I have to be very general in this way of working with people to help them to see stuff. So they're beautiful people with good intentions, no doubt. You know, that nobody is malicious. Nobody is intentionally hurting anybody. I'm not criticizing anything, you know, even though people, when I speak out about pathology, people take it as a criticism because they are invested in that identity. They're triggered by it. You know, they feel threatened by what I'm saying. But it's like, who knows, you know, like in the big picture, you know, it's kind of like what's really going on. Yeah, they can be present with others sometimes, you know, which is helpful, is healing, depending on their level of adversity, depending on their investment in pathology, depending on the way they work and what they've been trained in, what modality. You know, it's kind of like if it's a psychiatrist, we've quite often been, you know, full blown pathologizing model, you know, where everything comes under a sort of criteria of 6 to 9 ticks in a book, you know, and so on. And it's like that's all they have. And sometimes, you know, more person-centered approaches, people know that people have the well-being within them, but they don't really know how to point to it. You could call it the art and the science, you know, like the science is that every person has well-being, no matter what. And the art is how do you point people to that? You know, how do you help people? Like, I know it, but how do I help somebody else see it? Because if I just sit in front of someone else and going, hey, you've got well-being, they're not going to go away going, oh my God, yeah, that's it. I'm great now. I'm fixed, you know? So all that, you know, is all part of that work with people. And I like to think it all makes sense in the grand scheme of things. You know, nobody's intentionally hurting anyone. That's the most important thing. Could they do better? Yeah, absolutely. In the grand scheme of healing and the amount of pathology and struggling and suffering that there is out there, yes. But also as well, the people that are suffering that they're helping, you know, are in some form of that conditioning too. You know, they are a lost person creating a concept of themselves in order to be found. And even you'll know this yourself, people come to therapy or coaching or whatever you want to call it, spiritual teaching, you know, and they want to be a good client, or they want to know better, or they're too much in their head, you know, and so on and stuff like that. So they can be challenging people, you know, that really want to get well, but then are stuck in that identity. So that it works down the chain, you know, like training for therapists, and then how do they work with people, and so on and so on and stuff like that. But yeah, it's all beautiful. It's all a beautiful journey, and sometimes challenging and very human, you know.
Yeah, no, I get that. So you talked about the awakening or spiritual insight without bypassing real life pain. How do you hold both of these together in your work?
Yeah, from an experiential place, when you've seen it for yourself, you know, there's nothing you have to do to hold it together. You know, it's like it just is you. It becomes you. It's embodied experience. So like I don't have to. I know people have well-being when they come to me. You know, it's kind of it's my job to point it out and help them see it for themselves. You know, as I see it, and um, I also know, and I only know any of these things because this is my journey too. You know, it's kind of like my own journey into spirituality for many years, trying to bypass my experience using spiritual concepts like learning non-duality, learning Advaita, learning all the Eastern traditions, and then like being all cocky and like the ego. I mean, in my second book, I started to write about this in the first chapter. I call it Walking in the Dark, and it's really about the willingness to walk in the dark, not for the ego to take hold of spiritual concepts and take ownership of spiritual concepts as if it's superior to other people and say, well, I'm enlightened, I know this and you don't, and I need to teach you this for you to get where I am. That's what the ego does. But it's not. It's coming down to meet people where they are, you know, and to be present, human. Like that's the most spiritual thing you can do, you know. So having lived that attempt to bypass my experience, and then going into the world of trauma and somatics and being willing to be in what I call the dark room, you know, like, which basically is your body, you know, come into your body and feel, and be willing to sit in the presence of another in discomfort, not knowing when it's going away, not knowing how deep it's going to get, not knowing how terrifying it's going to be. That experience of going into yourself, you know, and being with yourself, only because I've been through that can I guide other people in that, and know when they're, you know, I know when someone starts talking too much or starts telling me a story, you know, it's kind of like something's going on straight away. I'm attuned to that kind of experience of where something's uncomfortable for them right now. And I don't, this is not about re-traumatizing people. It's not then for me to force them back into their body. It's like to say, like to engage with them and say, what's going on right now? You know, did something feel uncomfortable? And then just to acknowledge that part. And I like the IFS book. I don't know if you've read it, No Bad Parts, you know, like, but it's really seeing that, you know, the intelligence of everything, like the intelligence of numbness, the intelligence of nothingness, the intelligence of distraction, the intelligence of all these things. You know, they're all an intelligent system showing up even in the session on a one-to-one basis, because it's uncharted territory, because I've never gone there in myself, and this feels a little bit uncertain, and I'm not really sure who this guy is, and is he safe with me, and can I, is it okay to feel, you know, what happens if I cry, will he judge me, you know, it's like, that's what's really going on inside the person, you know. So only because I've gone on that journey can I really sit with someone else and see that, you know, and see it clearly. And that's why you can't learn this in a book, and you can't just take it on and decide to do it. You have to live it, you know, you have to go on that journey yourself.
Can you tell us about one myth about recovery or healing that you think is actively harming people?
Yeah, it's like it was, again, I was writing it in the first chapter of the second book. It's like the myth of that healing looks a certain way. Like quite often, right? It can look like grief and chaos and um, unpredictability and just crazy moments, right? That can be the healing. It's like there's this myth that somehow if you're healed or you're spiritual, that it will be all bliss or flatlined or you'll be joyful or happy all the time. Sometimes the biggest shift, the biggest movements towards yourself are in the chaos. They're in the unpredictability. They're in the uncertainty. They are people that are unapologetically themselves, that don't fit in with everyone else, and everyone else judges them and goes, oh my God, that guy is crazy. And that might be the most grounded person in the room, because they're willing to speak out beyond the conditioning of societal norms. They're willing to say something that other people are not willing to say because it doesn't fit in. They're not going to be accepted anymore. They're willing to be disliked. They're being authentic to themselves. So that's the biggest myth, as I see it, is this whole idea that healing is one, linear. It's like once you're healed, you're okay. And two is that it looks this certain way. I sometimes describe it as no one's sitting around in the lotus position chanting Om with their palms up all day long. It's kind of like when they're healed, that's not how it looks. It's the messy experience of being unapologetically yourself, like you leaning into who you are and being yourself and being willing to be disliked, just to be true to yourself.
Yeah, I guess there's all sorts of things there that's coming up for me, and often, like, if people looked into my life, they probably see a bit of a hot mess from times, but I'm a hot mess who's at peace with themselves and happy, as happy as a human being can be, and as content as a human being can be, knowing that I can only reach a certain level of contentment and a certain level of happiness and a certain level of being okay. But yeah, I think most of the time people would see a bit of a hot mess, if I'm honest. Uh, and uh, that's healing for me.
It's not sellable, is it? I mean, that's the thing. I call, the film 8 Mile. Like, I like to say that I 8 Mile myself. Like where he just throws himself under the bus in the rap battle near the start. I do that with myself all the time. I don't write as if I'm some healed person and I'm speaking down to people. I write as if I'm just a messed up human being like everyone else. But the thing is, it's not that sellable, because from that place of I just want to stop, it's not the solution. Like, I just want to stop. Oh my God, that guy hasn't stopped. It's like, I don't want what he's got. But that's really, like the person who's asleep can't dream of what it's like to be awake. It's kind of, so it's not sellable. It's saying, hey, I'm very human too. It's kind of like, what people are wanting to buy is, I'm healed, I'm perfect, I've got it all good. It's like, but I have no other way. I've just this strong feeling of regardless of whether it sells or not, I'm going to be authentic and say how it is.
Yeah, no, and yeah, there's plenty of other alternatives out there that people can go and seek out for themselves and see if what's on the label is what's inside the tin. But I agree with you. Now, for someone listening who's struggling but also questioning the system, what would you want them to know right now?
For me, I talk about like the experience of in my book, and I remember it quite clearly, that people used to say to me in 12 steps and around treatment and kind of methadone and all this, all the stuff that I went through at the time. You need to stop seeking. Seeking is your addiction. It's kind of like, so what you need to do is stop seeking, find a way like to live your life and just get on with it. It's like, but I'd say never give up seeking. Don't give up believing that there is a place of home. You're not broken. You can't be broken. You cannot be damaged. There's a part in you that will keep seeking and keep longing. And we don't know what that is. I didn't know what that was. So it was kind of like I seeked, or I sought in external things, sought in relationships, in sex, in money, in everything, right? That's because the seeking in me is just misguided. I don't understand it. you know, and what that seeking is your intuition of home. It's you knowing that there is a home, a place of respite, a place of peace within you. But no one has ever pointed you there. You know, no one has ever guided you that way because they haven't found it for themselves. The people that you go to, it's innocent. They just don't know it. So know that, and be more curious about yourself, about your seeking, about your longing. You know, what is that actually for? You know, if you can, which most people can't, it's difficult, it's challenging. Ask yourself that question. Take a moment, if you can, in nature, on the beach, by the seaside, hug a tree, whatever it is. You know, it's like walking your dog, making contact with an animal if you don't like humans, because most of us don't like humans, you know, in our struggles. Ask yourself, what is that longing for? Because it's really your own heart, you know, your the energy of your own heart connecting, you know, connecting to the world, connecting to yourself, and it won't go away. You know, that longing feeling, that seeking feeling will not leave you. It while you're alive, it will exist, you know.
Okay, so getting on slightly, let's say, bit of a change in topic. 3 books people should read before they die, and why?
Yeah. I have to say my own book. If you're listening to this podcast, The Infinite Recovery Project is really everything we've talked about. It's the journey of, you know, like beyond pathology, of realization. It's got my own story in there a little. It's not about me, although I do use my own experiences, insights, but it's really the journey to yourself. It's for you, about you. It's written that way. It's not written about me. It's written for you. So many books. If you're spiritually inclined, then Osho, Living Life on Your Own Terms, absolutely amazing book. So easy to read, so simple language, and so many hard-hitting insights and impacting moments for me in that book. And I've read many of Osho's books, and I think they're really cool. They've definitely influenced my work. If you're kind of on the fence, more psychologically inclined, not so spiritually inclined, maybe The Inside Out Revolution by Michael Neill, because that was one of the first books that I read on this journey. And that was where I had my insight with Michael Neill many years ago. And that book is really kind of helping take that step. That moment that I had is really what's described in that book, where I realized there's a subject-object perception going on. There's something more to me than I am my thoughts. And that's a beautiful book, like gentle, you know, for somebody who's less into the abstract, more spiritual, and it's very readable and sort of everyday stuff. Yeah, I mean, God, I've read so many books. It's kind of like over the last few years, I'm constantly buying different books and buying them, and there's so many good ones. Can I add one more, actually? Let the Moon Be Free by Eric Barrett, which is it's a Eastern traditional translation. Eric Barrett is French, and it's translated Kashmiri Shaivism. But that was a hard-hitting book for me as well, in simple language. And the way those Eastern traditional books work is like quite often there's people asking questions and the questions are answered. So the transcripts of audios, and people would come with questions like you and me that have lots and lots of questions, you know, about suffering, about struggle, and so on. And really the spiritual teachings kind of they don't answer the question. They just tell you why you shouldn't have a question in the first place, you know. And that those books like got rid of a lot of questions for me, you know. They really helped me kind of see beyond my mind's questions, because the questions come from the mind. How to, why, when, you know, all those forms are mind-based questions. And we have to move beyond the mind to really kind of find freedom, you know, to see that. And yeah, those are some great books for sure.
Okay. Well, yeah, they sound great, and we'll get some links for those books from you, Jason.
Yeah.
We'll include them in the description should people want to go and check them out for themselves. Obviously, your book in there as well.
Yeah.
So 3 books that people should avoid, and why?
Look on my shelf. TA Today. My training manual, you know, for my 4 years training as a psychotherapist. Too deep in psychological concepts, complicated and abstract. and it's leading you away from well-being, more into frameworks and concepts about people. And from this place where I am now, it's like that is really moving away from well-being rather than towards it, and yeah, maybe I had to go on that journey to come to this place where I am now, to know that. But overall, I wouldn't recommend that, something I picked up recently. I'm a simple reader now. It's probably a great book, but I picked up Joseph Campbell's The Hero's Journey because it's so complicated language. I just had to put it down again. I really struggled to kind of stick with a book for that particular reason. I like simple language. Now, for somebody highly intellectual, maybe it's good, But I think there's a misunderstanding in the world of the hero's journey. I think the journey is to yourself, and it's not to follow. And it's used quite often in marketing as if you do something and then you teach other people how to do it. And I think it's kind of misused. That's why I picked it up. What else have I got on my book, on my shelf? There's not many that I buy that I didn't really like. Easier to say books that I do like.
That's okay. If we've only got two, you get four that people should read, so maybe only two that they shouldn't.
Yeah, I mean, like even those, when I say shouldn't, I would probably say don't listen to me, just follow your own inner guidance more than my word, But that was why I struggled with them more than anything,
No problem. Okay, so 3 favorite actors and why?
Denzel Washington, I'd say. Very much a felt experience of watching his movies, like you can really connect with the character and you go through an internal experience watching those movies, some like Man on Fire was one of my favorite, and it's just very heartfelt, like because he's looking after a little girl and I've got a little girl, and so on. You can connect with the movie. Actors, who else? Mark Wahlberg, I think, is really cool. I like watching him. He's always plays a great part in stuff, funny kind of in the movies, and Adam Sandler as well from a funny point of view. He's kind of like very comical to watch and entertaining. Great actor.
Brilliant. Okay, so 3 favorite musicians or bands and why?
Go with Stone Roses. They can't really sing, but there's such a great feeling to going to. I've seen them live many times, and for over the years, my childhood memories and stuff. It's very, very. Just love it. It's great. Pink Floyd. Like real music and. Technically amazing, Pink Floyd music and many memories in that from years ago, and even today it's just timeless and priceless. Music, what else do I like? I've seen so much stuff. Coldplay, because not so much like I do listen to their music, but live, I've seen Coldplay live so many times, and it's such a great experience. It's just a real kind of entertaining, very present. You can struggle to go to a Coldplay concert and just sit still and just not to be have a great time. So I'd say that was a great experience.
Excellent, great choices. Like the Pink Floyd choice, especially. 3 things that you would take to your desert island. So this is your desert island. So it can already have cheating a little bit. Can already have some stuff there that we can just assume might be there. So a few people have tripped up on this question and they're kind of gone, has it got electric? Or can have whatever you want, but I'm not talking about something that means something of significance to you. What are the 3 things you would take there?
Yeah, it's quite easy. I would take my girlfriend and my kids, my 2 kids, because I feel. Yes, the 3, because I feel I've just been with them a lot this summer so far, and I feel so at home when they're in my house. My girlfriend's rested on me, my kids are asleep. I feel at peace in myself, and it's a peace beyond any other. A safety, a kind of knowing where my kids are, that they're in my house and that they're safe, and my girlfriend's with me. My system feels safe, and. I can't move beyond that,
Beautiful choice. Okay. So is there anything that you wanted to ask me?
I don't have any questions, but I will say, in order to have this conversation, you must have been on some journey. I recognize that and I acknowledge that, because you're very sensitive and very present, and you're willing to be with yourself and to sort of sit quietly and to wonder and to be curious. And I think to be able to just be that kind of person in this conversation, which is challenging to some, right? If some of the stuff I would have said may have been challenging to you, but it definitely would have been challenging to others. Really shines a light on the journey you've been on yourself, So I want to say that I recognize that and I acknowledge that, and it makes for a great conversation. Now, everyone else might not see that, but I see it, and I wanted to say that. So thank you for that.
Oh, thank you, Jason. I've really enjoyed our conversation. I really enjoyed some of those more kind of insightful moments, and especially those really beautiful, tender moments as well. So it's been great to kind of be here to share that with you. And obviously, I want to thank you for giving your time and coming on to the podcast. And definitely hope it reaches a lot of people. And I will now pick up your Infinite Recovery book and I'll go and read it, because I haven't done that. So having met the person, and I would invite you, if you get time, to read my book, or if you would like me to send you a signed copy, please do pop me an address or a PO box or anywhere, and I'll send you one if you want to read it. But obviously, if you don't, that's fine
Yeah.
also. Um, and and I guess just on that, is there any final suggestions or takeaways for anyone watching?
Just on the book, yeah, I'd love your book, and I will also send you one. So if we exchange addresses, then I will send you one of mine. I've got one here. If anything more, I mean, there's so many little things, if anything more, it's kind of, if you've sat and listened to this whole conversation and you're still here, and you have a beautiful feeling in your heart, trust that, that's your guidance system, that's your connection to yourself. And sometimes healing is more than the words, it's more than the concepts and the ideas, it's just the feeling that you get, so that's telling you everything.
It's great. That's a really nice note to end it on, Jason. And we'll be in touch, swap addresses, and
Yeah.
all the best. Thank you so much.
Thanks, Colin. Thank you.